Good morning. This is Hossam Ibrahim, and I'm having a presentation here on hemorrhoids. First of all, hemorrhoids is a disease in the bottom area, in the rectum area. It's like a swollen and inflamed veins in the rectum and the anus that causes discomfort and bleeding when sitting or using the restroom. And if we look at types of hemorrhoids, there are two types, the internal ones and the external ones. The internal hemorrhoids are the one that's on the line, on the internal wall of the anus, but the external one, you can see it and feel it on the outside of the anus. If we look at the pathophysiology of hemorrhoids, they can usually be caused from straining during bowel movements, obesity, sometimes pregnancy. Of course, being constipated helps growing them, because when someone is constipated, they push the stool hard, and this makes the vessel gets irritated. In external hemorrhoids, there is excess blood that can be collected and develop a clot, and this collection of blood, of course, causes pain when using the restroom. Epidemiology of hemorrhoids. In the US, we have 1.5 million related prescription related to the hemorrhoids. In other words, we have between every 20 Americans, they have one person that have hemorrhoids. Of course, it's common among men and women. And it's common among people aging above 50 years old as well. Worldwide speaking, we have the percentage is in overall is 4.4%. If we look at the signs and symptoms of hemorrhoids, if a person has a hemorrhoid, he can somehow diagnose themselves by themselves. I mean, they can see the part that, in the case of the external hemorrhoid, that's coming outside of the anus. There is also some symptoms for hemorrhoids like itching, bleeding, irritation in the anal region, especially when using the restroom. Of course, in case of bleeding, the person has to see a doctor immediately to avoid like colon disease or colon cancers and stuff like this. Also, symptoms have like swelling around anus, pain in the rectum area, and constipation. Differential diagnosis. Sometimes hemorrhoids can be mixed with some other diseases that happen in the same area. Like, for example, here we have fissures. Fissures is it's an infection or a tear in the lining of the anal canal. We have also other disease that happens in the same area, like anal cancer, prostatic inflammation, rectal prolapse, inflammatory bowel disease, or perinatal abscesses. Perinatal that happens in the perineum area between the anus and the genitals. How to do a physical exam for internal hemorrhoids? We need to do digital examination. In other words, we have like endoscopy, and the doctor also sometimes can get like he can put gloves, lubricated, and put a lubricate on his fingers and feel it inside the patient's anus. For external hemorrhoids, of course, as we said before, you can feel it and see it in the outside area of the anus. Tests. This is for gastroenterologists or surgeons. They do, as I said earlier, endoscopy or sigmoidoscopy. Sigmoid is a sigmoid area, like the end of intestines, the last part that looks like the S letter, as Dr. Branger said in the lecture. And of course, digital rectal exam should help you diagnose hemorrhoids as well. How to treat hemorrhoids? Sit bath. The patient can sit in a tub with warm water for like 30 minutes. This helps the inflammation to go down, then the veins and the blood to relax. The patient can use aloe vera and the soothing wipes. For medicines, the patient can get stool softener, and the stool softener and laxatives, they make the stool move smoother when using the restrooms. You can use softeners like Miralax, Dorcolax. All of these reduce the friction in the anus when using the restroom. For the pain, we can use Tylenol or Benadryl. And to treat the hemorrhoid itself, we can apply creams like Hemorrhoid cream, Hemorrhoid Max, or Preparation H. You can use Preparation H as a cream, or as an ointment, or as suppository. Prognosis. Luckily, hemorrhoids themselves, they are not deadly. It's not like a big issue, but it needs to be taken care of. Internal hemorrhoids may become severely inflamed and prolapse. And also, if it gets worse, it's going to fall outside the anus, and it's going to be like external hemorrhoids. Sometimes they can be complicated and cause blood clots in the external hemorrhoids, or something known as skin tags. It's like a piece of tissue or flap of tissue that hangs off the skin. How to prevent hemorrhoids? Number one, when you use the restrooms, you should avoid straining at all. Take your time in the restroom. Try to eat healthy and lose weight, because obesity is one of the main reasons for hemorrhoids. Having a high fiber diet with a lot of vegetables and fruit, this will help the stool to move smoother. Drinking a lot of water, it makes the rectum area. I mean, if you don't have enough water in the stool, it's going to be like hard rock. Of course, it's going to give you issues like constipation, and when using the restroom, it's going to cause friction. It's going to hurt. And of course, definitely avoid stressful. Avoid being stressful, because stress is related to veins, and when you get stressed, it's like it gets tightened and it gets worse. Conclusion: hemorrhoids is an inflammatory disease in the rectum and anus. Discomfort is a common symptom, especially during bowel movement or when sitting. Other symptoms include itching and bleeding, having a lot of water, and when eating food, it should be accompanied with stool softeners. In some cases, a medical procedure to remove the hemorrhoid may be needed to provide relief, to take the whole thing out, the internal and external hemorrhoids. They are treatable by medical professionals. They are, should be without A, they are chronic. They can last for years or be lifelong, but they are not deadly. Following a healthy, high fiber diet and living healthy should help you avoid having hemorrhoids. Eventually, this is preferences. If you'd like to take a look at them. And thank you so much for your time and your watching.